The NHS won't get extra money unless it reforms. That's the message from Shadow Health Secretary Wes Streeting, who has written this in The Sun. If the NHS doesn't change, it will die. For the Conservatives, the NHS is covered in flashing signs warning, danger, do not touch. They know the public don't trust them with it, so they daren't change it. Only Labour can reform the NHS. It won't happen overnight. It will take a decade of change and modernisation to make the NHS fit for the future. Now, this is really interesting, I thought, from Wes Streeting. So there's a sort of a theory in political science and political sociology which says it's easier to do a right-wing policy if you're a left-wing party, or a right-wing or a left-wing policy, if you're a right-wing party. So it's called the Nixon goes to China theory. So the argument goes that the reason Richard Nixon was able to make peace with China in the 1970s was because he was seen as a very right-wing president. So he essentially had permission to do it. It would have potentially been very damaging for a Democrat to go to China because they would have been called soft on communism. But because no one suspected Richard Nixon of being a communist, he could go and meet Mao, right? So background here, America used to recognize Taiwan as the real China for a couple of decades. Very ridiculous policy, ended in the 1970s. The theory, the Nixon goes to China theory, says that this can apply to many things. So people look at the 90s and they say the reason why Bill Clinton and Schroeder in Germany were able to introduce labor reforms was because, they were considered to be of the left, so they could introduce right-wing policies and people would think, oh, that's not them being ideological, that's them being pragmatic, whereas Streeting seems to be explicitly saying it's only going to be the Labour Party who are able to introduce the kind of privatising reforms, the kind of marketisation that people would be very suspicious of the Conservatives if they were to do it. It's an interesting argument. It might be worrying to you if you don't want to see the marketisation of the NHS. The reforms Streeting talks about include more routine operations on the weekend, collaboration with tech entrepreneurs, and using spare capacity in the private sector. He also made a jab at the people he thinks might oppose his plans. Middle-class lefties cry betrayal. The real betrayal is the two-tier system that sees people like them treated faster, while working families like mine are left waiting for longer. Very interesting. Working class families like mine. Now, he's on a decent income, so he's sort of saying, why should I have to use the NHS when all you middle-class lefties go and use private? Now, not many people in this country do use private. It is growing because the NHS is such a state, but sort of the idea that all of these people who are, quite protective of the NHS are on the side going and using private healthcare. I'm not sure I really buy that argument. Anecdotally, that's not the kind of people I meet who are campaigning for the NHS. And Wes Streeting explained a bit more about his thinking on Good Morning Britain.
Labour's already made some significant commitments for additional investment, but in every single case, that investment is linked to reform. So because we know that action is needed to cut waiting lists, and some hospitals have shown us how to do that with clinics that work at evenings and weekends, albeit with a cost attached because you have to pay staff fairly, obviously, to do that work. We've committed £1.1 billion to cut NHS waiting lists, providing 2 million appointments a year to get those waiting lists down. But that's linked to the reform element of extra evening and weekend working. On mental health, where we've committed £750 million to make sure that we address the mental health crisis, particularly affecting young people. That's not just more money for the existing system, it's new services, making sure that we get to young people sooner through support in every primary and secondary school and community mental health hubs in every community. And even on scanners, where we've committed to double the number of diagnostic CT and MRI scanners over the course of the Parliament. That's not just more scanners, it's AI-enabled scanners so that we can diagnose faster and more accurately, getting more people diagnosed because you can do more scans. So that investment is also linked to reform. And that's the argument I'm making to the NHS and actually to the country, because we want a mandate for this reform.
I'm not sure this makes much sense. So what I was saying before, and I think is the argument he's making in The Sun, obviously to a very right-wing readership, right? He's saying we will be trusted to do the kind of reforms that the Conservatives couldn't get away with. Now, the only kind of reforms that Labour might be trusted to do that the Tories wouldn't be are, say, marketisation, right? Because when the Tories do it, everyone says they're privatising the NHS. When Labour does it, they can say we're improving standards in the NHS. And to be honest, I mean, historically, when New Labour did it, they were often it was part and parcel of a package which did improve the NHS. And when the Tories do it, it is part and parcel of a package which is making it worse. So it's not completely unreasonable. But the idea that these controversial reforms, which only a Labour Party would be able to introduce, are more mental health services and more scanners that use AI. There is no one in this country who is saying, oh, I wouldn't trust the Tories to introduce more scanners. I'm only going to trust the Labour Party to introduce new scanners. So it seems to me that he's not really laying his cards on the table there. He says, we're going to do difficult reform, like introduce scanners with AI. I don't think you're going to get sort of walkouts in the NHS because you've got all these radiologists saying, we want to make sure no AI can be used in the NHS so that we can keep our jobs checking whether people have cancer or broken bones, right? Pretty much everyone working in the NHS is saying, we are massively under capacity. We're overworked. We need something to take the strain off us. I think they're going to welcome AI when it comes to scans. Now, we've discussed sort of AI in healthcare on this show before. There are many parts of the healthcare system where it doesn't seem it will be that transformative because so much of the healthcare system is about human-to-human contact and care, which you cannot replace with a machine. I do think that the scanning, so scanning for cancer, particularly cancer, right? Because AI, I think, is potentially already better than a human doctor at working out what may or may not be cancer. I think at the moment you still need a doctor to sort of sign it off. You won't be diagnosed by a computer, but in terms of picking out where there might be cancer, I do think AI is better than the naked eye. I've digressed a little bit. Ash, give me your comments on Wes Streeting after me babbling for about 10 minutes there.
All this man knows how to do is punch left and talk shit. And lo and behold, he's done both again. I mean, this first thing about, middle-class lefties who, sneak off and use private healthcare, I mean, that's just a complete straw man. And secondly, when he then starts talking about these planned reforms, there's nothing that the left or, the doctors or nurses unions are going to get particularly up in arms about. Really, I think what he's talking about is the idea of, further marketization and privatization. And is that something he's willing to do because he's the authentic working class and everyone else is just a middle class hypocritical virtue signaler? Or is it because he accepted political donations from people with stakes in private healthcare? I don't know. Why don't you tell me which sounds more plausible? I mean, I also object to the idea that there are certain reforms that the Tories just wouldn't be able to do, because particularly if you look at the time period of 1997 to the present day, I would say probably the biggest package of reforms that came into the NHS were the Andrew Lansley reforms as part of David Cameron's government. So I don't think it's the case that that was an area that the Tories really feared to tread. It's just that after that time period, they were having to deal with the consequences of their disastrous reforms and underfunding. And I think also the long tail of some of those new Labour reforms that you were making reference to. So this thing of, Labour's reforms were part of a package to improve the NHS and they were trusted with it. I think one of the things that you need to remember about Tony Blair's approach to the NHS is that he was trying to increase spending without fucking with the tax burden. And that's one of the reasons why, you had these PFI contracts, which overall became really expensive and in some cases failed to deliver much needed maintenance and upkeep and building works to the NHS estate. In the long run was more expensive, but in your sort of like day-to-day expenses, they're like, okay, this is a cheaper way of getting money into the NHS. My argument for that would be, sure, it had those short to medium terms, positive impacts on the NHS, but on the longer term, is left us with some very expensive problems to solve. So I would quibble with, the Nixon goes to China analogy here, particularly because of Andrew Lansley, and also the characterisation of New Labour's reforms to the NHS. Don't get me wrong, increased spending, very, very good. Decreased waiting lists and waiting times, very, very good. But ultimately, I would say that PFI was a very, very bad thing for the NHS.
Well, we're going to go to someone who really knows what he's talking about when it comes to the NHS. We're going to go to the expert. It's the leader of the Reform Party, Richard Tice. They're pledging an extra £17 billion a year for the health service. And this is how Richard Tice said they'd pay for it.
The annual cost to the taxpayer of net zero is over £30 billion. One of our policies is to scrap net zero. That provides the money. The other key area...
How does it provide the money?
Because that's the money that the government is currently spending of taxpayers' funds in the public sector on trying to achieve net zero, which will make no difference to climate change. And what I'm saying is, I think the British public would rather zero waiting lists in 2 years than zero CO2 in 25 years. That's the choice of the British people.
Polling suggests that the British public are broadly
because the British public haven't been told of the cost. They haven't been told of the cost, which is over £30 billion of taxpayers' cash every year. And we've got a healthcare crisis, we've got a staffing crisis, we've got an A&E crisis, we've got an excess deaths crisis, all because we're not getting on top of these waiting lists.
So Richard Tice there saying net zero will have nothing to do with climate. I think he is a bit of a climate skeptic in general. Ash, this doesn't strike me as the way to save the NHS, to sort of say, screw climate change. I'm sure lots of people would also quibble with his £30 billion figure. I was looking at this today, sort of what is supposed to be the cost of net zero. There was, from the Office for Budget Responsibility in 2021, I think they said it was going to cost £20 billion a year. But lots of that was actually just from lost petrol tax, which we wouldn't necessarily think of that as being a cost to government, because it just means people have to pay less petrol tax. We just tax something else, I suppose. But what do you make of that? Electorally, I can see what he's thinking. People like the NHS, and there are, actually in general, net zero is somewhat popular, but there is a section of society who are getting increasingly concerned about it, in part because of GB News and people sort of spreading fear about it. But he's saying, NHS good, climate change bad. That's the sort of segment they've decided to appeal to in the electorate. Will it work?
Well, it's not too dissimilar from the Brexit campaign of 2016, which was EU bad, you can get rid of all this waste, and then you can put all that money into the NHS. Now, we left the EU. Did we get £300 million a week for the NHS? Fuck no. So
apparently we did actually, but that was only because of COVID. Sorry. So what they always say is we did actually increase it by £300 million, but that was just to pay for all the test and trace and everything.
Well, yeah. I mean, there were also some downsides to the pandemic. So I hear. I mean, increased funding for the NHS per week, great. Loads of dead people, well, not so good. But I think it's hard to make the same line stick twice, right? So it's like, all right, fool me once, shame on you, fool me twice. And I also think that there's something, I don't know, given enough time and given enough funding, the leaving the EU position went from something very, very fringe to actually happening. And I think one of the things that it did is that it tapped into that vein of Euroscepticism, which was always strong in this country, but which had been accommodated by the sort of half in, half out position that we had with the EU anyway. We didn't have to join a single currency, didn't have to join Schengen. We had those opt-outs. They were able to tap into something which was already there. In terms of the net zero stuff, there isn't particularly strong antipathy towards net zero. What there is strong antipathy towards an increased tax burden or other, hikes in household costs. So that's not quite as direct as, tapping into a well of established Euroscepticism, but it could be done. And with a media machine behind you, you've got money and airtime on your side. There's something instinctive in me saying that it's a harder story to really nail.
It's also a harder sort of, it's not a referendum, is it? So, the Brexit Party are not going to become the opposition after the next election. We are in a two-party system.